Hello. All right, this is Unit 3 for ASL 2, the body, health, and emergencies. So the first section is on the body. So body or physical. Sometimes people initialize physical, but it's better to do it this way. Arm, or if it's part of your lower arm, you can also just point to that area. Leg, you can point to your leg, finger spell leg. Stomach or gut, stomach. Brain or mind, and then think. So think is once. Think. So we have know with a B hand shape. Think is with a 1. And then brain or mind. Anything having to do with that, cognitive, cognition, anything like that is the same sign. Hand. So it's the sign for hands. Hands. And then if there's something wrong with your hand, you can always point to it. Head. Muscle. Muscle. Bone. Foot is fingerspelled. Sinuses, you can fingerspell sinus or sinuses. Okay, health and symptoms. Health, well, recover, brave, confident, courage too as well. That's also healthy, health or healthy. And then this other one has a bunch too. Normal, natural, nation, of course, nature, national, any other version of that in English. And then pain, hurt, or injury. Pain. So you can twist it, they go towards each other, or you can do this. And that's locational. So depending on where on your body hurts, you can move it around. Sign for headache, pain at your head, your shoulder, your neck hurts, right? If another part of your body hurts that it's not easy to do this with in the position that you're in, you can sign pain and then point to that area or fingerspell that area. Okay. Sick. So, sick. I just did headache. Nausea or nauseous. This just means your stomach is upset too. This can also mean disgusted in some contexts. If you're disgusted with something, like it turns your stomach. So the same concept. Breathe. Breathe. Dizzy. Dizzy. Sore throat. Vomit. Cough. Cough. Runny nose. Runny nose. So if you're sick, so you can sign sick or cold. This is cold, like to have a cold. And then this is actually an element classifier for like water running. And so when you have a runny nose, you have fluid coming out of your nose. So runny nose. Congested, nose stuck. Nose stuck. Okay. Diarrhea. This is poop. And then use a different classifier for that. Okay. Infection or insurance. Infection. Fever. Sweat. Sweat. Blood. Blood. Break. And this is to physically break something rather than like spring break, summer break, to take a break. That is this sign. So to break something versus to take a break. They're different signs. Sprain. 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 Burn is lexicalized. So B-U-R-N. Burn. If that's difficult, you can always finger spell it normally. And you can show like where it is on your body as well. Rash is generally red and then area. If you can easily show the area where the rash is, then you'll do it in that area. If not, you can sign red area and then point to that part of your body. And then itch or itch. Okay. If it's itchy in a specific spot, like a rash is itchy, so you say red area itch, right? But if you're just itchy in general, itchy. Okay. Cut. Cut is generally with your finger like this. So again, wherever it is, wherever you cut yourself. Trauma. Trauma. It's like it's ingrained in your brain. Danger or dangerous. Danger. Weak or fragile. Dead, die, death, any iteration of that. Okay. This represents one life ending and another beginning. So that's the concept behind that sign. And then symptom is the same sign as demonstrate or example. So if you're demonstrating something, that's another, conceptually it means the same thing as a symptom if you're ill in some way. Okay, illnesses. Arthritis. Shake the A. You can always finger spell it as well. Heart attack. Heart. Heart attack. Heart attack. Okay. Stroke is brain, and then the same thing. Brain. Attack. This sign doesn't mean attack, but it just means that there's an impact, kind of. I've also seen stroke like that because it generally affects one side of your body. Okay, head cold. I did that one earlier. Without facial expression, so if you're not like, oh God, I'm sick, it means Kleenex. So if you say, do you mind giving me a Kleenex? You're not saying, do you mind giving me a cold? So it's contextual. Roll around. This can mean toss and turn. So if you're like trying to sleep at night and you're having an issue with that. But it can also mean epilepsy. Context, right? That's important. Okay, bronchitis. So the sign for lungs. So then the sign for bronchitis is with the B, and then pneumonia is with the P in the same area where your lungs are. COVID. Cancer you can finger spell. I've also seen cancer that way. Alzheimer's, ALZ, or you can sign brain deteriorate. Bipolar. Okay. Depression. Anxiety. Anxious. Schizophrenic. Looks kind of similar to stroke. Starts with an S and then it goes down. Allergy or allergic. Nose, opposite. That's what it literally is, but allergic. And then chicken pox. Chicken. Okay, and then you have the dots. That's one situation where you might sign itchy in this way, right? Okay, emergencies. Emergency. If you do it this way, it means Easter, so emergency. Okay. Pandemic is sick, illness, disease, they're the same sign. Spread. Okay. Accident or crash. Okay. Disaster, chaos, mess. Choke, as in like you're choking on food or something. Choke. And then fire. All right. A few noun-verb pairs that I think are good to know. Blood pressure. So you can sign blood pressure as BP or blood pressure, like the blood pressure cuff that they put on you. And then to take blood pressure, it's once. So generally with noun-verb pairs, the noun is twice and the verb is once. So blood pressure, take blood pressure. Phone, and then to call goes out. So call you, call me. Okay, it's directional. And then ticket versus give ticket. So if someone gives me a ticket, you can do it directionally that way. If I give somebody else a ticket, this is like in the context most likely of like driving, right? If you get pulled over and you get a ticket. Okay, expressing competence or incompetence. Good at. This can also mean expert, kind of depending on the intensity of your facial expression. So when you kind of move your head back. Okay. Knowledgeable or genius. Knowledgeable. If you want to emphasize that someone is very knowledgeable about a topic, you can add another hand. Okay, they know a lot. All right, not good at, or incompetent or inept. And then skill, expert, or competent. So this is skill or skills. Sometimes people do it this way as well. And then the intensity again in which you do this emphasizes whether or not, or how competent or how skilled they are. So someone's very skilled versus, and it can also just refer to skills in general. So again, contextual facial expression matters. Okay, quantifiers. A lot. A few goes from an A to a 6. Few. Several is the whole hand. So a few goes from A to 6. Several goes from A to 5. Some, part, or section. And then many. So before we learned how many or how much goes up, many goes down. Many. All right, remedies and responses. Call 911, call 911. Okay. Help, we've already learned, but this is also the sign for therapy, so I think it's relevant to repeat. Sometimes people initialize it with the T, so that's good to be aware of. Look over, examine, search for in some contexts. This is the sign for search, but if you go to the doctor, for example, this is examine, or if you're looking for something, this is more of like a classifier, I guess, for your eyes moving around. Hospital, it's like the Red Cross. Okay. Urgent care, UC. Again, contextual, you can always fingerspell the whole thing. Surgery. Okay. Ambulance. Paramedic, you can sign EMT or ambulance person. Okay, medicine or treatment. Medicine. Take pill. So when you're talking about taking medicine, if you said, did you take your medicine, it somewhat varies depending on the kind of medicine it is. If it's a pill, you sign take pill. If it's like a liquid oral medication, you can do this, like you're drinking it. This is also the sign for alcohol or cocktail, but if you put medicine before it in context, right, it makes sense. Versus like an injection or a shot. So it's all dependent on what the usage method is. Prevent, protect, block, defend. This can translate to a lot of things in English. Inhaler. Ice. Finger spelled usually. Sometimes people sign frozen to mean that as well, but if you need ice to something is swollen, right? Vaccine or shot, injection. Mask. Rest or relax. Band-Aid, or like wherever it is, you can do that as well. Versus bandage, you just show wrapping it. Soap. So butter, soap. Alarm. And then quarantine, sick, alone. So by yourself. If it's already clear in the context that you're talking about an illness, you can just do this and then alone, or just that, like you're staying in one place. Okay, diagnose. D, this is time for a label, and so it's to apply a label, but it's initialized. The other version of that is DX, diagnose. Okay. Rescue, safe, save. Evacuate, people or people. Okay, they're getting out. Warn, warning, alert. Warn. Okay. Plan or prepare. This can also mean to organize and a couple other things in English, but depending on context. Okay, dishes and silverware. Kitchen. You can do the initialized kitchen. Sometimes people do kitchen, like this is cook, right? So kitchen, or cook room. Cook room. Glass or cup. Fork. Fork. So we learned mean before, and then fork. Fork. Spoon. Spoon. Knife. 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 People see knife. Or knife. There's some variation. Plate or dish, and then bowl. All right, other vocab. High. High or high. It kind of depends on what you're referring to. Low. Low. This is to like decrease, down, up. Immediately, fast, quickly, immediately or immediately. Okay. You can also sign fast. This means fast, but this is like immediately. Cover. Cover. Keep. Keep. Exercise. For keep, you can also do save. This is then to like save something, to save money. Sometimes people do it like that. Okay. Arrive. Any, and then other. Other. So other goes out, any goes down. Feel. Spread. Spread. So to spread out. Weekend. Weekend. Long. So minimal pair was slow. Long. Up to now or since. Cause. Cause. Better. Better. And then best goes up higher. Best. Newspaper is twice, and then print or publish is once. Letter, so letter as in the alphabet is like this. Letter or mail, like you're putting a stamp on a piece of mail, is like that. All right, leave there or lose. Leave there, left, lose. Okay. To leave. Leave. Or go away. You can also sign leave or leave, as in to leave very quickly. Candle. And then wash. Wash is generally with the A hand shape, but it depends what you're washing. If you're taking a bath, it's like this. If you're washing dishes or something else by hand, if you're washing a car or a window, something that's in front of you, sort of depends. It kind of becomes a classifier. Love, so difference between loving a person and a thing. Love a person, love, versus to love anything that's not a person, love. Okay. And then I love you this way is more casual, versus if you push it forward, it means I love you. Key, sometimes, it goes towards you. Context, wow or wow. Show up or appear. And then the opposite is disappear. So show up, appear, disappear. Okay. And then stop, cease, anything along those lines. Sometimes you can use finish to mean the same thing there, so, but stop. And that's it.